Hi, I'm Dr. Jennifer Maxfield-DeCarlo, Director of Clinical Services at Safe Harbor, and I'm here today with Jonathan DeCarlo, one of our certified DBT counselors. Thanks for coming, John.
Thanks for having me.
We're going to talk a little bit about what DBT is and just kind of what the program does for folks, who's appropriate for the program. Just wanted to spend some time explaining what DBT is. Sure. So let's start off. We hear DBT and everybody wonders, like, what is that? What does that stand for?
Dialectical behavioral therapy. Two opposing ideologies can exist at the same exact time. It's an amazing principle.
Awesome. So one of the things in the research is that there's a ton of research about the effectiveness of DBT. And this is from Marsha Linehan's DBT program. And there's 4 areas that DBT really focuses in on. And those are distress tolerance, mindfulness, interpersonal relationships, and emotion regulation. Who are those appropriate for?
Well, in my opinion, it's appropriate for everybody. But when we talk about like severe depression or severe anxiety, maybe borderline personality, substance use is another great area. It pretty much spans the mental health spectrum.
Yeah. So I know a lot of folks that are probably watching this are like, well, I don't know if I have any of those things, but I have really intense emotions. When situations come up and they don't go quite the way that I want, like I have really intense emotions and I don't know what to do with those. DBT would be helpful with that.
Sure, yeah.
Okay, cool. So let's go through each area and just kind of talk about what is distress tolerance?
Well, distress tolerance is kind of when we get to a point where, you know, a skills breakdown point where we can't manage things. Distress tolerance teaches us to pretty much put a pause in between, you know, what my emotion is and then what my reaction is going to be. And it gives me time to really get into the other skills like checking facts and, you know, really you know, being able to, like deep breathing, for instance, is, you know, a great way to kind of, you know, bring ourselves down. So for those that have a very low distress tolerance, being able to put that space in between is really helpful.
Okay. So it sounds like it really focuses in on skills that are going to help you in the actual situation.
Sure, yeah.
Yeah. Okay. How is that different than just normal therapy?
Well, normal therapy, you'll talk and there's different modalities and you know, it may be structured, it may not be structured. DBT, on the other hand, is very, very structured in that there is a hour and a half, 90-minute skills building group. There's a 1-hour individual session each week, and then there's 2 kind of text check-ins, so we can check in to see, you know, what skills are working, what skills aren't working, are there barriers, those types of things. So it's you get a little bit more kind of assistance than you would just in a standard outpatient setting. Okay,
so it's a little bit more intensive.
Yeah,
gives you more touch points during the week. Okay, so I know that some people watching this are thinking group therapy. I don't think so. I don't really want to be in a group setting. I'm shy. I don't. Why do the groups and the skill-based stuff for the groups?
Group is really, really cool because you have a group of individuals that come together with a common thread, which is there's something that isn't quite what they want in their life and they all want to fix it. So being able to have support of other people that understand, you know, kind of what they're going through, and also having, you know, somebody come into the group and saying, hey, like I'm using this particular skill and this is working for me, and other people will go like, hey, right, well, how did you get that to work for you? So they get to kind of be an extra added support unto themselves within the group setting.
Yeah. So you get to journey with people who are actually testing out each of these skills as well.
Yeah. Yeah.
That's awesome. Okay. Another piece of this is mindfulness, right? And I know some people hear that and they think, I don't want to do yoga, right? That's the first thing that people think. Mindfulness, I don't want to do that. What is the benefit? I mean, we're not just talking about that kind of thing. We're talking about creating space to be present in situations. But what is the benefit of doing that?
Well, so mindfulness is really, really great because it allows us to become in tune with ourselves. So a lot of people, when they first come to me, are like, I'm very anxious. I'm like, okay, well, where does that anxiety come from? Where do you feel it? And they're like, well, what do you mean? I'm like, well, is it in your shoulders? Is it in your chest? Well, through this mindfulness practice, we come down grounded into the present moment, and we start to become more aware of what's actually going on. And there's people that will come in and say, hey, well, I've been so depressed until I finally realized that I wasn't, but they don't know when that transition happened. So that mindfulness allows us to be so in tune that we can start recognizing our own patterns, our own reactions, our own physical reactions, and being able to ground yourself into the present moment allows us to kind of get into the rest of the skills.
Yeah. And I mean, I don't want to get too scientific here, but it really does change the way that your brain functions.
Rewires it, yeah.
Rewires your brain to be able to be in a moment, even a distressing moment, and be able to be present, feel the emotion, know what's happening within you so that you can respond with some of these skills. And that's really the goal.
Exactly,
right?
yeah.
Okay. The last piece of this is that DBT really focuses in on interpersonal skills. So when I'm thinking about people who might be appropriate for the DBT program, those folks who are constantly in situations where they're having intense emotions, where they're having difficulty relating to family members. Even we have groups for teens and children who are maybe needing the words to be able to describe how they're feeling and how to relate to other people and their social supports.
Sure. Well, it's not only important to know like what to say, but also setting boundaries. I know that a lot of people that come in don't know how to set boundaries, and that leads to a lot of their distress because they don't feel like they can say no. They don't feel like they can ask for help, is another big one. And so all throughout, and that's usually the last part of the thing that we go through within the groups is that interpersonal effectiveness, right? How, how much, or how heavy should I ask for this versus, not asking for this, right? And there's specific skills and things that they can use to determine, like, is this important enough for me to want to dive into, or is this important enough for me to say no to? So having the words yes to be able to speak, and then also knowing how to set healthy boundaries.
Mm-hmm. Yeah. Awesome. Well, so we're just going to talk a little bit more about our program here at Safe Harbor. We have groups starting all of the time, and each person that comes into the DBT program, first you do a screener that really evaluates if you might be appropriate. That can be found on our website. And once you do that, then someone will reach out to you and give you more information about the program, and then also turn you over to our intake staff who will make sure that you're able to look at your insurance, because insurances cover DBT services. Our groups, as Jonathan mentioned, every person that comes in, including our children and adolescents, come into a 30-week program. And what that does is that every week you have a group that is 90-minute skill building, and then you have individual therapy, and then you also have, as Jonathan mentioned, 2 text check-ins that can be used if you're in a crisis or having a difficult time, to actually have a one-on-one with your therapist for a few moments just to get some encouragement, work on the skills, remind you of the skills that you've been learning. So once intake reaches out to you and tells you more about the program and your insurance coverage, then we work really hard to match people in groups together, because you really go through the program as a cohort where you're going to be able to be with the same people for 6 months. So we match you with a therapist that will fit in a group. So there's a little bit sometime of delay in getting people into the program as we're formulating those groups, but we do have groups starting all the time. Yep. For more information, you can look on our website and under our DBT program to see more information.